Welcome to the Ministry of Health's Weekend Review. As the season of joy and giving unfolds, here are the highlights from this past week. On November 29, His Excellency President Dr. Mohamed Irfan Ali and Minister of Health Honorable Dr. Frank Anthony turned the sod for the state-of-the-art $4.5 billion Keto Hospital. This project represents a major investment in healthcare infrastructure for Region 8. Delivering remarks, His Excellency Dr. Mohamed Irfan Ali highlighted the transformative impact of the new 75-bed hospital in Region 8.
This hospital will have 75 beds. 45 of which will be inpatient bed. And this is not open ward. You will have like 5 beds only in a ward. Each ward will have its own washroom, its own shower, will have its own support system. 100% first grade hospital beds, not cots, will be part of this hospital. The duration of this project is expected to be 24 months. It will have a fully functional operating theater equipped to do, Frank just told you that we will take the people out who need cataract surgery and we'll have to take you to Port Moran. But I have news for you. In this hospital, they will be able to do cataract surgery right here in this hospital, right here in Region 8.
Meanwhile, in his remarks, Honorable Minister of Health Dr. Frank Anthony highlighted the significant investment in Region 8's healthcare system.
We were able to put in at least $22.7 million for the region. And then in 2021, we increased that to $72 million for the health sector in this region. By 2022, we increased that even further to $90 million in this region. And then in 2023, we added $365.6 million for this region. And these are monies that came directly from the Ministry of Health centrally to the region. And then this year, 2024, we gave from the central ministry to the region $508 million. This did not include the monies that were put in the regional budget for health.
On November 30th, the Ministry of Health National AIDS Program Secretariat hosted the 2024 World AIDS Day Conference, focusing on advancing a human rights approach in HIV care. The event brought together healthcare providers, representatives from various healthcare facilities, organizations, NGOs, and other key stakeholders to deepen the understanding and collaboration in combating HIV/AIDS. During his remarks, Minister of Health Honorable Dr. Frank Anthony emphasized the importance of acknowledging the progress made in the fight against HIV/AIDS while addressing ongoing challenges. The minister called for a shift in conversation around HIV/AIDS, moving from merely reporting statistics to implementing actionable strategies that drive tangible improvements in the healthcare outcomes.
We look back. At the time, we didn't have medications, and at every step it was a struggle. We started the first clinic at the Georgetown Hospital, then we tried to get those clinics out. We didn't have a home-based care facility. We weren't able to do home-based care. We weren't doing VCT. And each one of those things, I can actually go back and we can tell you how some of those things started. So today, when you reflect back, we have indeed come a very long way. And I think that in itself is the reason for celebrations.
On December 2nd, Minister Anthony met with Her Excellency Hua Ai-hen, the outgoing Chinese ambassador to Guyana, for a farewell courtesy call. He extended gratitude for her contributions to the healthcare sector during our tenure. On December 3rd, the Minister of Health, Honorable Dr. Frank Anthony, visited Region 6, where he toured the construction site of the new 75 Village Regional Hospital to assess its current stage of development. This hospital will feature a 75 inpatient bed, 3 large operating theaters, a mining operating theater, a neonatal unit, a modern laboratory, and other state-of-the-art facilities and services. Additionally, Dr. Anthony visited the Port Morant Hospital to tour the facility and interact with healthcare staff and patients. This visit reaffirms the government's commitment to enhancing healthcare services and addressing the needs of local community. Following these visits, the minister met with the leadership of various hospitals in Region 6 to discuss challenges and initiatives aimed at improving patient care. During the meeting, he underscored the importance of providing adequate resources and support to healthcare professionals to enhance healthcare delivery. On December 4th, the Ministry of Health's Vector Control Services, in collaboration with CCM, hosted the Malaria Country Dialogue at the Ministry's boardroom. This dialogue brought together key stakeholders, including representatives from the Miners Association, the Ministry of Finance, the Ministry of Marine Affairs, the Guyana Geology and Mines Commission, CCM members, and other healthcare workers. During his open remarks, the Honorable Minister of Health, Dr. Frank Anthony, highlighted the ministry's ambition to transition from malaria control to elimination. He noted that while Guyana has benefited from the Global Fund grants addressing HIV, tuberculosis, and malaria, the country is gradually becoming ineligible for such funding. The dialogue concluded with a commitment from the stakeholders to align their efforts with the ministry's goal of malaria elimination by adopting innovative strategies and fostering collaboration across sectors.
Our focus primarily for this morning would be malaria, but obviously with the Global Fund. We have had grants dealing with HIV, TB, and malaria. One of the things that you should note, however, is that while we would have benefited over the years from the Global Fund, that we are becoming ineligible for Global Fund funding.
On December 5th, the Ministry of Health, Disability and Rehabilitation Services, in collaboration with the National Commission on Disability, have officially launched the Building Accessibility Handbook 2025. The Building Accessibility Handbook is envisioned as both a guide and a catalyst for meaningful change. It will equip stakeholders across public and private sectors with practical tools to prioritize inclusive infrastructure, accessible communication, and culture transformation in Guyana. Delivering the keynote address, the Honorable Minister of Health, Dr. Frank Anthony, commended the NCD for its outstanding work in enhancing the lives of persons with disability. He also highlighted the challenges many face in accessing public spaces. Meanwhile, Dr. Ariane Mangar, Director of Rehabilitation and Disability Services, said the handbook is more than just a guide. According to her, it's a blueprint for dismantling barriers and creating spaces that empower all individuals, including persons with disability and seniors.
For persons with disability, when you try to go into some public buildings, there's always a challenge. And especially with the older ones, because trying to climb a stair, if there isn't a ramp, you're going to have problems. And that by itself would deny that person whatever service that building is offering or the people in the building is offering.
This week highlighted transformative strides in healthcare across Guyana. Join us next week for more updates.